knew something was wrong, but you just couldn't put your finger on it. And that is exactly how I felt. Something was wrong. I just didn't know what. I just didn't know how to describe how I was feeling. A little, maybe not quite as sharp, a little more easy to fatigue. Things were just a little bit more difficult, but it wasn't like I had a broken leg and I couldn't walk. Have you ever had a concussion and felt like you're inside your own body, but you're watching from just off center? That's the best way I can describe it. It's not dramatic, it's just off. A slight difference. Enough to make everything feel unfamiliar. And the worst part is, you can't quite explain it to anyone. This is episode 20 of Concussion. Today, we're revisiting last week's conversation with CBS meteorologist Lonnie Quinn. Not to rehash it, but to reflect on what hit hardest. The words he said that echoed my story, and probably yours too. We talk about invisible symptoms, anger, fatigue, and the people in your life affected by what you can't quite put into words. This one's for the survivors, the professionals, the spouses, the teammates, for anyone trying to understand what happens after the concussion. I'm Travis. Let's get into it. Hey everybody, welcome back to Concussion. I'm Travis.
And I'm Abby.
Today we're here to, we're going to do a quick recap of the interview with Lonnie. We're going to touch base on some things that really hit home really hard, especially for me. I'm Travis. I crashed my motorcycle about 9 years ago. And was going about 130 miles an hour on a motorcycle raceway, and was kind of left to my own devices as far as recovery. I mean, I did go into the hospital for quite a while, and when I finally got out, I met my physical therapist, Abby.
That's me. So I was a physical therapist at the time, and we crossed paths in an outpatient setting. And the irony behind all of that is Travis had a severe injury to his brain that really needed the attention and healthcare intervention. But he was sent to this outpatient clinic because he had stiffness and pain in his ankles. Travis and I crossed paths again 9 years later, and we both realized how much could have been done at that time if I knew better and if he had some insight as to what it means to have a concussion or traumatic brain injury, if he had the medical guidance that he needed to get the right care at the right time. So the two of us decided that we need a platform in order to be able to discuss that. We needed to have ways for people to become more familiar with the effects of a concussion, what can be done on the healthcare intervention side, and how recovery can look moving forward.
And especially the more I talk to everyday people who have had concussions, the more and more obvious it is to me that this is absolutely needed, because they're repeating my story to me over and over, and they have about as much awareness of the situation as I did when I first got a concussion, which is absolutely none. And hearing my exact words reiterated over and over just really make me...
It gets eerie after a while hearing your story come through other people. But then again, it's just more of a call to action. If all these folks are in this same situation of not having any idea what to do to help themselves, or even that the things that they're experiencing are related to their head impact, there's a reason that we're sitting here every week to discuss that, and hopefully it'll bring a little bit more awareness and a voice to what happens after a concussion and how those folks can get some help and some sense that they are not the only ones going through this after a concussion.
Yeah, and if they even know that they're going through something, I mean, they certainly know that something is happening, but it's very hard to, like Lonnie said, just put your finger on it. It's very hard to just put your finger on it because you can't, there's not words for it. And when you go to maybe a doctor who is good at fixing ankles, say, or good at fixing knees, or a lung doctor or a heart doctor, and you say, man, I just don't feel right. A heart doctor is obviously going to check your blood pressure,
They're going to do the things they've been trained to do.
Because being a doctor is very complicated.
Yeah, and there's a lot to know. Not everyone can be an expert in everything, but knowing what questions to ask to get you to the right person is something that we could hope would start to change.
That would be great.
And to recap on Lonnie, so he is a meteorologist for he
CBS.
Works for CBS. Works out in New York, and he also does national broadcasting. He's got a very high pressure job.
Yeah.
He has to have a very quick response to changing conditions, has to be great at memorization, great at multitasking, great at his visual spatial awareness, because he has to deal with objects that aren't there, but he has to direct people to and understand that whole spatial component when he's on the air. And he was kind enough to share his story with us that he was in an accident New Year's Eve, went to the emergency room. He had some testing done there, and he explained it very well that the emergency room, their job is to make sure you're not in life-threatening danger. They need to triage you. Yes.
Yeah. What is a triage?
So triage just essentially means prioritize.
Prioritize.
Yeah.
So we want the people who are in immediate danger, whose vitals are blood pressure 60/30. That's who,
going to the top of the triage there. So triage is essentially an assessment that would help you establish priority and needs for care. And for him being brought in after a motor vehicle accident, they need to make sure his neck isn't broken, make sure his brain is not bleeding, make sure all of his vital organs are intact in his abdomen. And then they'll screen for any other orthopedic injuries. If he's complaining of pain in his thigh, they'll make sure he didn't fracture his femur. But that's kind of the extent of it. And he mentioned that doctors will often check if your pupil restriction and dilation is symmetrical and if it's appropriate, just because that's a very clear sign that there might be building pressure in the brain that would indicate they would need to do further testing. But
that's why they check your pupils, like there's pressure.
Mm-hmm.
Oh, okay. I didn't know that.
So the job there is make sure, is this guy safe? Is he going to make it through the night till tomorrow, the next few days? Is everything stable? And they did that. However, their recommendation to him was just take Tylenol and ibuprofen. You'll be good in a couple days. So that's kind of how we reference that the most common response to impact to the head is 3 days off of work, tussin and a Band-Aid. Like here's some Robitussin and a Band-Aid. Just because we don't have the front lines on their triage capacity. For instance, let's say he did have a broken leg or a sprained ankle. They would give him a referral to follow up with an orthopedic doctor outside of the hospital.
Okay.
But if we knew the right questions to ask to see if he had a concussion or a traumatic brain injury, they could have gave that same recommendation to him to follow up with a neurologist or a concussion clinic, somebody who specializes in this. But we still have a lot of work to do for that to be on our radar on the medical side in each capacity, whether it's in your primary care doctor's office, in an orthopedic office if you have a sports injury, or in the emergency room if you have an unfortunate accident such as what he had. So for 6 weeks, he took the advice that he was given of using Tylenol and ibuprofen around the clock to try to get through his day. And he was candid in explaining all of the challenges that came with that. And immediately, Travis, you could start picking out things that just sounded so much like your experience when you first came home.
Yeah, it was absolutely identical. I mean, he was saying things like verbatim that I said, thought. And like I said, I was talking to somebody today, and he repeated the same exact things that Lonnie was repeating. Like he said, when Lonnie said, but I just didn't know what. I just didn't know how to describe how I was feeling. a little, maybe not quite as sharp, maybe a little more easy to fatigue. Things were just a little bit more difficult, but it wasn't like I had a broken leg and I couldn't walk.
So for Lonnie, it took him losing vision in his left eye to be able to have some sort of follow-up medical encounter. And the reason for that was his coworkers thought, oh my goodness, he might be having a stroke.
Yeah.
So what that says is, as a society in general, we're much more familiar with the signs of a stroke than the signs of you hit your head.
Right.
So if it weren't for that symptom getting so extreme that it affected his vision, so pressure in his head possibly relating to that change in visual field in his left eye, he wouldn't have gone back to the emergency room for more workup.
So there's like acronyms for being able to identify a stroke, right? Like
There is. Do you know what the acronym is?
SMILE.
FAST.
What is it? FAST.
FAST. So it's for each letter there has a symptom of a stroke, but smile, you're right, is one of them. So if somebody smiles and their face droops, if they raise their arms and one arm deviates, those are all indications that someone needs immediate care, because if somebody's having a stroke, we all know time is of the essence.
Right. Yeah. Gotta get them there like right away. And FAST, FAST, and F is.
Here, I'll get to the full acronym as the American Heart Association or the American Neurology Association would list it. So like even in libraries, in hospitals, their screensaver comes up as that FAST acronym, just so that way there's opportunities to educate folks regardless of your background. You don't have to be in the medical profession to know that. So the F is for facial drooping, so the smile part that you mentioned. The A is for arm weakness. S is for speech difficulty, so if they're slurring their words. And then the T is for time. You have to call 911. So time is of the essence. So that's what their FAST acronym references.
Maybe, hopefully with this podcast, maybe we can eventually come up with some acronyms for
the symptoms of a concussion.
The symptoms of a concussion.
Okay. That's something to put in the think tank.
Yeah. I mean,
that's actually a great idea, because that's what it takes for everyone to be more familiar with it. Like think about it, like DARE program.
Right.
For educating younger folks to stay away from drugs. It took an acronym or something that's easy to remember or recognize.
Yeah. Yeah. DARE to keep kids off drugs. And yeah, acronyms like.
I think DARE is an acronym too.
Drugs are.
It's drug
ridiculous.
and something.
Extremely.
Education, I think. Let's see the DARE acronym. Okay. So acronym DARE stands for Drug Abuse Resistance Education.
Gotcha.
But all to say that if you take something you want people to know more about, you have to make it simple, easy to recognize, and then it starts to catch on where people are more aware of it.
Yeah.
So you're right. If we did have an acronym for concussions or a quick phrase or something, it might make folks a little bit more aware because they have something to tie it to, something to make it more recognizable.
Yeah. And because most people that go through this, unless you got a brain bleed, they're not really tracking what's happening. And like you said, there's no words for it. So,
yeah. So that, it was kind of like the unfortunate but fortunate part for Lonnie is he had a much more severe symptom develop that people as a whole recognize as you need to go to the emergency room. You could be having a stroke. So at that second emergency room visit, there was a little bit more thorough of an investigation as to what could be leading to that. So they first go through that same triage process of ruling out anything immediately threatening.
Brain bleed.
Stroke. Seeing if, cardiac condition, everything. I'm sure they looked at everything that could relate to that. So when all that was ruled out, then it was, how do we help this guy? Because obviously we're not going to say, take some Tylenol and your vision will come back.
Right.
So then they had to refer him to somebody who sounds like he's an excellent pioneer in concussion care, Dr. McAllister was the one that he referenced that
Yes.
really made the difference for him. And Lonnie went to him, I think, not fully understanding what to expect. So if you know something's wrong, but you don't know what it is, it's less intimidating in some ways.
Yeah.
And he had to come away from that meeting with his doctor finding out that there's something wrong with his brain.
Yeah.
And he said that was just a really hard pill to swallow.
Yeah, that sucks. I hate that.
Yeah.
Like, because there's nothing wrong, you know? You don't want to think, oh man, there's something wrong with my brain. Because I don't, you know, that was took that one kind of hard. I was like, wait, there's nothing wrong with my brain. Like, I'm fine. Like,
and then when you're presented with evidence that there's something wrong with your brain, that's even harder because now other people can see it.
right.
Now the doctors are calling it something. It has a label and a diagnosis, and it means something is wrong.
And like he said, there's a stigma around that. Like, people just automatically assume that maybe you're not as bright, or maybe you need help, or maybe this or that, or whatever it may be. People make assumptions, and that is the stigma that he's talking about, you know?
Yep. So having that conversation with the doctor, and then he said that his coworkers and his boss were just phenomenal in the level of support that they provided. And I will tell you for certain that that is an anomaly.
Yeah.
That is not everyone's experience. In the folks that I encounter on a day-to-day basis, they're put in this position where everyone scrutinizes the fact that they're saying they're having trouble because of a concussion. They want that proof, but they're not a medical doctor. They can't read an MRI. And they have to educate everyone around them as to what that concussion means, and have to face this uphill battle of, I have to explain an injury nobody can see to be able to get the support, resources, or care that I need. So that's a huge scrutiny, judgment, and pressure because they didn't understand what was happening to him.
Yeah. And, you know, thinking about that, Lonnie's got like a white collar job. You know, he goes in and broadcasts to, I mean, very difficult, very hard. But I feel like the level of people who are in white collar work would maybe be a little bit more open to accepting something wrong with, you know, that they might not be able to diagnose. But if you're, you know, my dad was a carpenter. You go on the job site and tell a carpenter, man, I'm just not feeling it. My brain, you know, I got to hit my head pretty hard, you know, or guys who lay concrete or bricks, you're getting zero empathy, or
right,
zero.
They're going to hand you a shovel and tell you to keep going.
Right. Get over it.
Pick up
Dude.
that
You're
drill,
fine.
carry this, get over there.
Yeah.
You're exactly right. Like
quit.
they're not going to have they're not going to ask a single follow-up question.
No, zero.
They just get to work.
Right.
Yeah. And as we know, trying to force your way through that without getting treatment does not mean it will just get better on its own.
Right. You know, there might be the occasional guy who, you know, the occasional carpenter or concrete pourer, you know, that is open and empathetic, but man, that's certainly not going to be the majority.
Yeah. And I'll tell you from my experience, if you do come across somebody who can hear the word concussion and all of a sudden start to understand the implications, it might be because somebody very close to them had a concussion or they did.
Yeah. Yeah.
That seems to be the only way that you turn to the advocacy side, is if you've experienced this yourself or someone that you care about, to have an understanding as to how this person may be feeling and how they're struggling at that time.
Yeah.
So this doctor was able to gather troops of support for Lonnie by kind of gathering them all together, explaining what's going on with him and what a good action plan would be. And for him, that meant stepping away from his line of work that he's done for, I think he said over 17 years, was it? Or 20 years?
27 years, 27 years.
An incredible amount of time. He's really good at it. And that's different, of doing something for 20 years versus being good at something for 27 years.
Yeah.
Loves it, has tons of charisma. People depend on him. And he mentioned an extra layer that somebody's always waiting in the wings to take your spot.
Oh yeah. Oh yeah. That's a big thing. That hit me too. Like somebody's
Mhm.
waiting to take your job.
Yes, you're all replaceable, and that reality hits in different ways. But when you're having to trust this doctor and take his recommendation to step away from what has been your life and a big part of your identity for this long, I really admire Lonnie for trusting that advice
Yeah.
and for announcing publicly that that's what he was going to do. Because at that time, he did not know what was going to happen. He didn't know if his concussion was going to get better day by day. He didn't know if that 6 to 8 week timeline was going to hold up for him. He didn't know if he'd still have a job
Right.
afterwards. That's a lot of pressure.
Yeah. It exposes vulnerability.
Mm-hmm.
And I think that's a true sign of character when you can expose your vulnerability, because everybody is vulnerable. Some people may not admit it or even believe it themselves, but everybody is vulnerable. You're all just, human beings, and
We're all replaceable.
we're replaceable. We're pretty tough, but we're also extremely vulnerable.
So being able to do that without knowing what was on the other side is very admirable.
Yeah.
Because he brought attention to it as he was addressing it, instead of the route many other people likely would have taken of stepping back, using a very vague excuse or no excuse at all. He doesn't owe anybody an explanation on the viewership side. And then after it's better, then talking about it.
Yeah.
After he knows that there's a light at the end of the tunnel and that he's going to be back in his role, then talking about it. So I really admire how he went about that. And it meant a lot to people who may have been watching, who could have been in a similar circumstance. Seeing somebody else address it in that way now gives you a playbook.
Right. You can follow his lead.
Exactly.
And he's a very charismatic guy.
He was really enjoyable to talk to.
Very enjoyable to talk to. And I'm trying to emulate some of his charismatic ways. And I know he was like kind of moving around and he was pointing and smiling and laughing. And I just love that. I mean, I'm very much like that when it's like just people, but I am still learning to talk to Mr. Camera. So
that's a hard thing to do.
It is.
Yeah.
But I think we're getting better.
We are getting better at it.
Yeah.
Don't worry. We're trying to improve as we go along this path. So everything that he was able to put into his own words and his own stories seemed to pull out different components of what Travis has already discussed on the podcast.
Yeah.
And Lonnie was able to talk about the fatigue level, how he would get so tired so quickly. And he described himself previously as an energizer bunny. And the simple things like light sensitivity, all the way to the complex things of being quick to anger.
Yeah. And the difference in relationships between your wife and you, or your husband and you, the difference. And that's one thing my wife kind of said about me, that I didn't seem like the same person, because I was a little bit more quick to get angry about things, or I didn't have such, so much patience as I used to. And things that didn't bother me kind of bothered me now. And that was kind of one of the relatable moments that when Lonnie was talking, that I was like, yeah, exactly. Like, what is that? If it's him and I both, there are so many other people out there that feel the same way. Like, you get a concussion and you can't quite put your finger on what's wrong, but you get more mad, more easy, and you're quick to maybe raise your voice, whereas you wouldn't have before, or the things that make you mad now, aren't the things that made you mad before.
Mm-hmm. So it was very very powerful that he gave specific examples of how that has affected him, and how he described his marriage, and now they're, due to the assistance of this doctor, able to identify which things are out of character that are not him, but what he's trying to rewire, what he's trying to work through to be able to get back to the kind of temperament that he's used to, and all the relationship dynamics that come with that. I think he did a great job of also illustrating hope, which we need to make sure that we have a good balance of that in an effort to bring more awareness to what happens after a concussion. It sounds very devastating because it's disruptive. It affects
Absolutely.
all sorts of components in your life. But he was able to give more tangible examples of how doing vestibular therapy, doing ocular motor therapy, he had scores and tests that would show his improvement. And that meant a lot to make sure that we have those examples illustrated just as much as we illustrate the struggles. So the same way that, Travis, you've explained that driving's gotten easier, and some of these things that now you have words to put to the symptoms and you have interventions to put to the symptoms, Lonnie went through a pretty intense phase of that and noticed improvement, which is really important to highlight. Like knowing that what you're going through can change is of paramount importance when we are also talking about the struggles that come with dealing with a concussion.
Yeah, and I wanted to reiterate, and I was looking up something up there to talk about when you do get into arguments with your significant other. Not only is it you that is feeling something different, well, your significant other is also dealing with something that is completely, almost unbeknownst to you, but to your significant other, it's a whole lot of it's a whole new world, basically. And I'm actually reading this book right now, and this is what I wanted to bring up. It's called Love You Hard by Abby Maslin. And her husband had a traumatic brain injury, and I'm just barely cracked into the book. So that is it's something where the wife deals with, like maybe my wife dealt with, maybe he was more quick to anger. I don't know. I haven't read the book yet. I'm all, just like I said, I just cracked into it. And when Lonnie got into, he described an argument with his wife that he would have never had before. Like that obviously affected her as well. And I know my wife is like a saint. She put up with so much. And that is like a big something I wanted to note there too, because the significant other does deal with a lot. Yeah.
And things that they don't have an explanation for necessarily.
Right. And the person, like I said, the guy who has or the girl who has the concussion, if they can't put it into words, somebody watching them from the outside surely won't be able to put it into words. They just know that this guy just yelled at me, or this girl just yelled at something that they would never get angry about before. Yeah. That's like a big deal, that emotional toll between something that, used to be perfect. Never argue. And now it's like, man, argue. And that's something that Lonnie kind of mentioned. And that's something that happened to my wife and I. Same thing. Like we never, ever argued.
And something that was probably much more challenging for you is that you went 9 years without having any explanation as to why. So that means for 9 years, she didn't know what was possibly a consequence of your accident or what was maybe a shift in your personality. She didn't know that this was something that was related.
Right.
Because you didn't know. So how, like you said, if you don't have the vocabulary for it yourself, how are you going to explain it to anybody else?
Right. I think she started to know when she started to work back with you, because she was like, then I think she started to say more like, that's your brain injury. And I would,
really?
and I would say like, even years later, well, my brain injury is better. Like, it's like I'm fine.
Mhm.
And I don't think that's true. I don't think you ever quite fully become like exactly like you were before, which is like, that's like, so I was talking to some guys at work yesterday, and we were talking about like that's another thing that Lonnie and I talked about was getting back to, or get used to the new normal. And that was something that, like, I see that he didn't like when I said that.
He didn't want to hear it.
No, and I didn't want to hear it either. I was like, nah, I'll be back to normal.
Yeah. That's not something you want to accept, is that this is out of your control. You're going to be somebody different. But like I said, he is on the side of things where he's experiencing recovery and has evidence of that. But that's a question that only you, Lonnie, other people who've been in this situation would be able to answer is, are you ever going to be that version you were before? But the part of that that's so hard to answer is, even in the absence of a concussion or brain injury, you can't be that person you were 10 years ago. So
That's
like
true.
a lot of that is really hard to dissect out, but that's, like I said, nobody can answer that for you because you know yourself better than anybody. So being able to know what was a consequence of growth and maturity versus what's a consequence of new strains or responsibilities placed upon you, or what's a difference in how you process certain things after a brain injury.
I'd like to think I know myself. I'd like to think that. But sometimes it doesn't feel like I do. And if you've had a concussion, you might know exactly what I mean. We talked today about symptoms you can't see: fatigue, anger, confusion, about how it impacts your relationships, your sense of control, your ability to explain what's happening, even to the people who love you most. And that disconnect, that off-center feeling, it can make you question everything. But here's what I've learned. Just because it's invisible doesn't mean it's not real. This podcast is for anyone trying to make sense of what happens after a concussion, whether you're in it, treating it, or watching someone go through it. And next week, we're asking a question that hits hard. What if recovery isn't about going back to who you were, but learning how to live with who you've become? I'm Travis, and this has been Concussion. Take care of your brain and take care of each other.